Okay, good morning, everyone, and welcome. We're from Standing Committee of Medical Education in Ethiopian Medical Students Addis Ababa. This webinar is presented to you by the project named Hidden Curriculum. And under this project, we try to raise topics that are needs to be discussed in for medical students, which are not included in our curriculum. And this includes humanity in medicine. Under this topic, we have had an event before that was also uh, given by Dr. Ataklitie, and it was called Bridging Humanity and Medicine. If you have missed that event, we will drop the link in the chat box for you to check it out. Today, we will be, Dr. Ataklitie will be giving us a seminar on narrative medicine or storytelling in medicine. So about Dr. Ataklitie, if you've already attached clinical year or in a surgery department, you might have already known them because he gave us a lecture on plastic surgery. And that's how we knew about his interest in medical humanity, and that inspired us to include this topic in our project. To say a little bit about Dr. Ataklitie, he is practicing plastic and reconstructive surgery at Addis Ababa University. He's a fellow and program director at the College of Surgeons for East and Southern Africa. He's a president of Surgical Community of Ethiopia and executive member of Ethiopian Plastic and Reconstructive Surgeons. He is also an artist and photographer. He graduated in fine arts from Arts Academy, and he has also participated in Smile Train Family, which was a non-profit institute. He brought Smile for more than 4,000 cleft lip and palate uh, children. So this is a little bit about Dr. Ataklitie. Now I'm going to leave the stage for Doctor to tell us a little bit about himself and give us the seminar. And also we would like to thank Doctor for taking time from his busy schedule to and agrees to give us this seminar. Doctor, whenever you're ready, we can uh, continue the seminar.
ዛሬ እንግዲህ የምንወያየው ስቶሪ ቴሊንግ ኢን ሜዲሲን ነው። በተቻለ መጠን ታይሙን ለመጠቀም ሞክራለሁ። ብቻ ያደረገልኝ በጣም አመሰግናለሁ። የኢትዮጵያ ሜዲካል ስቱደንትስ አሶሲዬሽን ላመሰግን ወዳለሁ በዚህ አጋጣሚ። እንግዲህ የዚህ ፕሬዘንቴሽኑ ኦብጀክቲቭ ሶስት ነገሮች ናቸው። one is if we have a complementary approach to modern medicine, the role of storytelling in medicine, in other words, the attentive narration, and also do we have any other competence or knowledge other than the logical scientific knowledge that we've had in our medical schools. ለዚህ ኦብጀክቲቭ ሶስት ናቸው። በፍጥነት እንደሆንትን ለማለት ሞደርን ሜዲሲን ፕራክቲስ የሚያደርግባቸው ነገሮች አሉ። ከዛ ኮምፕሊመንተሪ አፕሮች ያስፈልጋሉ ወይ ነው would be introduced to storytelling or attentive narration. The third is would be also introduced to a very different kind of competence other than the logical scientific knowledge that we've had in the medical school. Rita Charon was the first person to introduce narrative medicine as a specialty by itself in 2000 in University of Columbia. And medicine is focusing on the disease, forgetting the whole individual per se. So if you go to your case presentations, for example, the bedside teaching, it's really highly conventional. It's traditional, and it has strict orders. Like you talk about chief complaint, and you go to the history of present illness and so on. And your physical examination is the same thing. It doesn't have a rich language capacity in terms of describing the patient's needs, the patient's view, and so on. And it's toneless. And it's very difficult also to address the subjectivity of the illness. So we are trying to diagnose the disease. We are trying to be more objective. So the flatness during our case presentations, process of gathering information doesn't have any emotional attachment. So we are basically detached from the patient. So modern medicine is a problem when it comes to storytelling, because we are in a hurry to operate or to treat more patients. That's how we are paid, and it's a performance-based process that we are in, and we are focusing on signs and symptoms. We don't try to access the patient's experience, the inner world of the patients. Basically, we are focusing on the body, not on the soul at the same time. This is what we call corporalism. And we don't have also the capacity to develop our narrative skill, the act of listening, the art of listening, and also reflecting, and also critically writing what we have heard. And we don't listen to the people's lives, their sorrows, joys, aspirations, pain, and other aspects of emotional expression. So storytelling is very important when it comes to uh, reconnecting us with the patient, and it is quite intermingled with clinical encounters. It will give us the chance to understand different meanings, and also we will share our understanding. Patients would feel that they are well heard and understood, and also potential changes can be also created in the process. There are two ways of knowing. Knowledge could be divided into two. One is a logical science, scientific, which is objective, based on facts. It is reproducible, and it passes through the researches, analyzation, and it become universal. It's based on empiricism, and this is basically what's happening in medicine. But a type of knowledge is very important, which is focusing on the subjectivity of the patient. And also, at a particular period of time, we can go into fields of truth and experience. We will understand and full social aspects of the patient. Uh, and hence, it will allow us to heal. The healing process is both for us and for the patient. As long as we are emotionally engaged into these processes, we are also suffering from the process. So the healing process through storytelling is both for us and for the patients. And ultimately, the logical scientific is based on the biomedical aspect of illness. It's like malaria is caused by a parasite, and you give drugs, that's it. But illness, disease, or sickness is really beyond that, which encompasses also other pillars like the psychological, social, and cultural pillars that are also affecting in a positive or a negative way in the care process. So the patient, we try to think of all the things in a very scientific way. We try to classify. We don't. We are very much objective. The objectivity part of our process is very profound. But in the narrative process, it's an individual experience that is also heard and analyzed and reflected. So it has a kind of singularity. Each and every patient is different. The story of each and every patient is different. So the singularity, how you make that particular engagement very peculiar, is very important. So basically, there is no generalization. Each and every patient has a very different story. And how it is important in logical scientific, it is a physician-based, physician-centered process. The patient doesn't have any chance to decide. So we are basically the ones to decide for the patient. We don't focus on the subjectivity part of the patient. In other words, if you have narrative knowledge, you will have the chance to hear the patient's voice, and the patients would be reflecting their views, and ultimately they will be involved in the decision-making process. So as I said before, the logical scientific is a very objective thing, which has ended up in detachment between patients and physicians, and they are very much distant. Physicians are very much distant from the patients. So if you have some kind of narrative knowledge, narrative competence, you will have this emotional connectivity, and the engagement will be profound. So narration is the ability to acknowledge, absorb, interpret, and act on the stories and be light of others. So this is a cognitive process through which you acknowledge, absorb, interpret, and ultimately act on stories. So that divides between us and the patient in basically four big things. One is the reality of mortality. For example, if you try to fail some diagnosis, for the patient, it is a death sentence. For the patient, this is the end of the world. But for us, we don't that much emotionally engaged and being affected. So one divide that you can see is the reality of mortality. The second is on the cause casualty, the cause of disease. The patient might have a very different views as to the cause of the disease. Ours is biomedical and it's not comprehensive. Aspect, forgetting the other side of illness. I was always telling you that patients have other sides of illness, the other side of illness other than the signs and symptoms. And also they tend to have an emotional breakdown, blaming themselves. They would be shameful, even blaming us, and they will have also fear. So all this for facts, for groups of facts, make us very far away from the patients. So narrative medicine is trying to be client-centered with reconnection. We hear to the story of the patient. We would understand the other side of illness. We understand also the other factors like the social, the cultural, and other aspects of illness. We get reconnected so that we will have the humility and we'll have also the chance to mutually understand each other and will ultimately develop also trust. In modern medicine, one of the problems is there is a mistrust. This is a global problem. Patients uh, do not trust physicians or nurses. It's more with the doctors. So this is achieved through study of arts and literatures, also other aspects of humanities, as we discussed before. So ultimately, uh, you will have also additional skills like the art of listening. We don't listen to people. Even at home, we don't listen to people. In the school, in the medical school, for example, we don't listen to our colleagues. We don't have that capacity of listening. The art of listening is not well developed. Also, observational skill is very limited. So basically, we'll have a very expanded view of the story of the patient other than the medical history. And also this would help us to be empathetic. As I said before, this process also would allow the patient to be in the center and also will have the power to uh, make the decision as a right logical decision. So how can we achieve this is through deep listening. We listen to the not only to the signs and symptoms, but also the other side of illness, as I said before, the feelings, the emotions, the fears, the frustrations, the expectations, the belief on all the processes from starting from making a diagnosis to a prognosis. So a deep understanding of illness experience is very important. So this is listening. You listen to the patient, you listen to the story, and then you do a kind of representation. You write it like you write a novel, and you critically also read. At times also you write the story together with the patient. So each and every patient, as I said before, is unique. So they want their story to be validated, they want to be listened, understood. And at all times, patients would require two things when they come to you. One is they want to be touched, the other is they want to be listened. So their story, they want to be validated. So empathetic uh, approach with a genuine interest and concern is very important from our side. And we have to understand that we are really disconnected. In modern medicine, we are disconnected. So we have to try to bridge this. And one of the armors, one of the approaches for reconnecting is storytelling or literature in medicine. So we have this narrative competence that you develop with the storytelling process, which gives you additional life skills. And also, it's advantages for us to understand, to have a kind of self-awareness process. We would like the chance to sit, examine how we walked, how we passed through time with a patient. And then we would have also the empathetic process coming in. We will also have the self-healing process with self-compassionate. So this competence allows us to examine biases, would allow us to go back and see our past experiences, and also allow us to use our past experiences to tackle the future. We'll learn about ourselves, our patients, and also our colleagues, peers in the storytelling process. So the art of medicine should encompass three big pillars. At the beginning, I was talking about disease, illness, and sickness and their differences. Here it comes again. The human body is what we call disease, but there are other pillars in relation to the patient himself or herself, and also the society at large. That is the psychosocial consequences, culture, familial influences, existing situations. Also, on the other side, you have the emotional and spiritual course that should be addressed. So if you try to really explore all this on your patient, number one, you will have a very strong relationship with your patients. And also you will be able to understand the disease in its totality. And also you try to engage the patient into the process, and you could have also this therapeutic coalition where both the physicians and the patients would have a healing process. And ultimately, the well-beingness would be reflected for both the patients and the physician. Well-beingness through writing, as I said before, you would listen to the patient and you would do representation, you write it, you critically write it, and also you do a close reading of what you have written or what somebody has written. Through this, you will have emotional equilibrium. Your equilibrium is not as soft as, you break to each and every moment, or you are indifferent. It should be in the middle. And also it should be able to allow you to heal. And this disconnection between patients and physicians would be much improved. So the narrative medicine would ultimately allow you to effectively understand, be empathetic and communicative, and overall the outcome of your treatment would be very much positive. There is also a spin-off effect when it comes to decreasing pain, decreasing burnout for physicians and nurses, and in its totality, there will be a healing of the soul and the body. This is happening through closed reading, reflective writing, and also critically analyzing the text. So this also requires not only the act of listening, but also it requires the art of writing, critically writing what you have heard from the patient. And also it should be critical, closed reading. It's a critical analysis of your text. So I will take you to how you would listen. Lunars came up with 6 C's. The first thing is conversation. The art of conversation. Like you give them, you hear to their own words, you write their own words, and it's a simultaneous process where you explore connections, new options, you probe, you guide without control or interruption. You should be curious, you should express a genuine interest to explore field emotion in action. You don't only listen to the symptoms like cough and so on. The feelings, the emotions, and reactions should be expressed. You have to be very cognizant of the context where, in relation to whom are you talking about, what is their beliefs and values, which could be religious and so on. This also is very important when you listen to people. Never forget that this listening process is a very complex process. It could be challenging sometimes for both the practitioners and the patients. Be cautious of limitations, the sensitivity, willingness to explore, to go into unexplored area. When you listen to a patient, there are certain areas where the patient may not be comfortable to talk about. So you have to be cautious, and you should be careful in terms of not being judgmental. If a person, for example, is coming for obesity surgery, you shouldn't consider this as a very, very abnormal thing. You shouldn't be judgmental. You should just be neutral and emotionally content. So listening is very different from this ordinary listening, because both the storyteller, one who's listening, they are deeply involved. There is a kind of mutuality, and there is a tendency for a collaborative process, and it's patient driven. The patient is, we just throw open questions, and the patient is just writing the story. The patient is telling us the story freely. It shouldn't be chronological. Ultimately, we will make it a chronological process. So it also gives you the chance to explore the other side of illness, to tell you the illness will be expressed. This is a kind of listening that we expect from the health professionals. So the art of listening is a very complex thing. It's not just a simple listening. When you listen also with your feelings. Body language is very important. As I said, neutral techniques should be used. You shouldn't be judgmental. Sometimes you might be forced to ask for paraphrasing. When you don't understand, you constructive question, you paraphrase for understanding again. Make sure that you have this self-awareness, and also ultimately whatever process that you have passed through in the storytelling, it is going to be reflective. In other words, both the patient and you reflect, you go back and you make kind of criticism on the process, which also includes questioning, as I said, paraphrasing. So I think it's normalized. And this you have now in your hands a story that is going to be written. This is what we call representation. And uh, somebody would also do a critical reading. So a person who has not had the chance to see the patient would have the chance to hear about the story and also affected by the story. So books would affect you. The same thing is happening here. You write the story at the end, and whoever is reading the book would be affected. So active listening, it requires acknowledging the one who is in front of you, and you have to be emotionally engaged. You have to understand the thinking, should be patient, give the chance, respect, and also it's good to have eye-to-eye contact during the process. Effective listening requires looking at the patient, the person talking. So there could be some cultural differences. Never interrupt and wait for appropriate time to interject. Otherwise, the person would stop talking to you or continue the storytelling. The mind and the body should be ready. Sometimes, your body may not be ready when the mind is listening, but you can do something else with your hands. So both your minds and the body should be ready to listen. So, and sometimes, people would understand that you are not listening to them. You just wander around. This indicates that you are not interested. Be open-minded, as I said before, never be judgmental, never try to justify, never jump into conclusion. And practice the art of mirroring. This is when the person is telling you a sad story. You shouldn't laugh. You should at least be emotionally engaged that story is a bad story. The opposite would also be with a person who's telling you a good thing. Then your body language, your expression should be mirrored accordingly. Non-verbal feedback is very important, like nodding, encouraging the person to talk more. So basically, effective listening is it requires a skill, and this skill should be developed. I'm sure so many of us do not have the skill. There are barriers for listening. When people are listening, that effective listening process is not occurring. One is when somebody is excessively talking, if you are some preconceived opinion, it could be cultural, it could be religious, it could be gender, whatever. If you also do some kind of distraction, physical, mental, visual distraction, or if you produce some sounds with whatever you have utensils in the room, process. So acting, also mimicking as if you are attentive, fake attention. Also, you have to avoid anger, sadness, avoid noises, and shouldn't be defensive or argumentative when you listen to people. You should be calm. So I'm coming to the final process of this narrative competence. There are three important steps. The first thing is you give attention to the story. You should be mindful. You should be observative. You should concentrate, and you should be empty to accommodate those expressions. Then you register also not only the words, but also the silence, the physical states also would be recorded. And ultimately, if you pass through this attentive process, you understand that the patient is a teacher. And we are lifetime learners. We learn from their stories. So the first step in the narrative competence process is giving attention to the story. The second is representation. You write whatever you have received in terms of words, in terms of expressions, in terms of silence, and so on. You just put them in words. This requires kind of creativity. Now you are witness for all the process, and should be audible, visible, and you will have a very strong, trustworthy process between you and them. And finally, you should be affected. Now you have the story written, you critically read it, and then you should be emotionally engaged. So the emotional balance that I talked about is the balance between emotional steadiness and the tenderness. The tenderness is you are so soft and weak. The steadiness is you are blunt. So the storytelling process would give you the chance to be balanced when it comes to the emotional equilibrium. So it allows us to be connected. We will witness, comprehend the suffering of the patients and ourselves. So this emotional equilibrium is very important for us. Areas of further exploration that we have to take as a second step is what are the theory of narrations, what is perception, what is representation. So what do we mean by close reading and reflective writing? These are my references. Thank you so much. Hello? Hello?
Hello, doctor.
Hello?
Hello.
Can you hear me?
Yes, we can hear you. Thank you.
ጨርሻለሁኝ።
Thank you, doctor, for the interesting seminar. Now we can open the stage for the discussions. And if any one of you have any questions or anything that you want to be discussed, we have around 10 minutes, so we can discuss it, or you can drop your questions on the chat box.
ሁሉም ሰው እንትን ብሏል። ታይቶት ነበረም ሜላት?
Yes, ይታይ ነበር።
Great.
I have a question.
Please.
Thank you for a very nice presentation. So my question is emotional equilibrium በምናስብበት ጊዜ emotional tenderness እና ከዛ ደግሞ በጣም ዲታችድ የሆነው ማለት ኢሞሽናሊ ደግሞ ምንም ኮንሲደር የማያደርጉ የፔሸንቶቹን እሱን ስናስብ እንዴት ነው ባላንሱን ለመጠበቅ? በጣም ኢንቮልቭድ በሆንን ቁጥር በጣም እንትን ባያዝድ የመሆን ነገር ይኖረናል እና እሱን ኢኩሊብሪየም እንዴት ነው መጠበቅ የምንችለው?
በጣም ጥሩ ጥያቄ ነው። አንደኛ አሁን ያለንበትን ስታተስ ስንወስድ we are more on the steadiness side ትንሽ ብንትነን ለፔሸንቶቹ እና የመጀመሪያው ሪአክሽን የሚሆነው through this story telling processes through this engagement with the patient በጣም ስትቀራረቢ ምን ስትይ የመጀመሪያ ፌዝ ላይ ኢሞሽናሊ አፌክትድ ትሆኛለሽ will be tender you would cry with a story you have listened to እነዛ ነገሮች ይመጣሉ ግን gradually when experience develop ያረክሽው የምትጅበት ጊዜ ግን ባላንሱ ይመጣል ስለዚህ የመጀመሪያው ፕሮሰስ የሚሆነው you will be affected for some time ፔሸንቶችን ታናግሪያለሽ በጣም ያሳዝን ፋይናንሻል ሊሆን ይችላል ካልቸራል ሊሆን ይችላል ብዙ ነገሮችን ኤክስፕሬስ ያደርጉልሽ you would be affected ግን later on when you build up the experience and build up the stories አንዳንዴ እኮ መጥፎ ስቶሪ አለ የምናዳምጠው ጥሩ ስቶሪ እናዳምጥ እንችላለን የዛን ጊዜ ባላንስ እያደረገ ይመጣል አሁን ግን ያለንበት ቦታ ግን we are very much detached far away ከነሱ በጣም ርቀናል እና እኛ የምናስበው ኪውር ነው የምናስበው we give the drugs we operate them that's it ህክምና ምን ብለን የምናስበው እሱ ነው this is just a small part of care ስለዚህ የኛ እንትናችን ከዚህ በጣም ከራቅንበትና ብለንት ከሆንበት ወደዚህ ለመምጣት የሚያስችለን ፕሮሰስ ነው ይሄን ፕሮሰስ በጣም የለምን ነው ስንመጣ የመጀመሪያው እንዳልኩሽ አፌክት እንሆናለን ሌተር ኦን ግን ባላንስ ያደርጋል
ኦኬ
አንድ ጥያቄ ብሩክ ጠይቆኛል ምንድነው እንግዲህ ይሄ ናሬቲቭ ሜዲሲን ኢንኮርፖሬት ለማድረግ መጀመሪያ ሜዲካል ሂዩማኒቲስ የሚባል ትምህርት መኖር አለበት ሜዲካል ሂዩማኒቲስ አሁን ሁሉም ወደ ሜዲካል ስኩልስ ካሪኩለማቸው ውስጥ ያስገባሉ አይዘር ኤሌክቲቭ አድርገው ወይም ደግሞ እንደዚሁ በፐርማነንት ሆኖ ግን በደንብ ስፕሬድ አድርጎ በ5 አመት ይሰጣሉና ናሬቲቭ ሜዲሲን is part of medical humanities ናሬቲቭ ሜዲሲን basically is the relationship of literature and medicine እና ግን እሱ የሜዲካል ሂዩማኒቲስ አንድ ፓርት ነው ለምሳሌ ፋይን አርትስ ኢን ደርማቶሎጂ ለምሳሌ የስዕል ትሬኒንግ ኢን ደርማቶሎጂ የስዕል ትሬኒንግ ኢን አሰሲንግ ኢመርጀንሲ ፔሸንትስ እነዚህ ነገሮች አሁን ከናሬቲቭ ሜዲሲን ጋር የሚገናኙ አይደለም እና the first step should be to open up a medical humanities department of medical humanities in the medical schools ከዛ በኋላ ናሬቲቭ ሜዲሲን መቀጠል ይችላል ብሩክ ከተመለሰልን በዚህ አጋጣሚ ኦሊቨር ሳክስን ብታዳምጡት በጣም ደስ ይለኛል መጽሐፎች አሉት አንድ ሁለት መጽሐፎች አሉት ብዙ ቪዲዮዎች አሉት እና በጣም የሚገርም ነው የእንትናም አለ የሪታ ሻሮንም አለ ኢንተርቪዎች አሉ ሌክቸሮች ትልልቅ ሌክቸሮች አሉ ኦፕንሊ በዚህ በዩቲዩብ የሚገኝ ኦሊቨር ሳክስ ሜላት ላይ እንትላችሁ
yes
ሄሎ
question ያላችሁ ካሉ ቻት ቦክስ ላይ እንዲያደርጉልን ትንሽ እንጠብቅና
what books should we read የሚለው ለምሳሌ የሪታ ሻረን መጽሐፍ አለ ናሬቲቭ ሜዲሲን የሚል ፍሪ ኦንላይን አለ ግን እኔም ራሱ እዚህ ስላይድ ምንድነው ፕሬዘንቴሽን ላይ ብዙ ጆርናሎች እና አጫጭር እንትኖች አሉ ፐብሊኬሽንስ አሉ ፕሬዘንቴሽኑ ስልክላችሁ እሱን ማየት ትችላላችሁ
እኔ አንድ ጥያቄ አለኝ ዶክተር
please
when we come to our ካንትሪስ ፕራክቲስ አንድ ፊዚሽን በጣም ብዙ ፔሸንቶችን ነው በቀን ወይ በአንድ ጊዜ ትሪት ማድረግ የሚኖርበት። ኦፒዲ ውስጥ ሲቀመጥ ብዙ ፔሸንቶችን ማግኘት ይኖርበታል እና ይሄ በጣም በርናውት ይኖራል እዛ ዶክተር ላይ እና ሃው ክን ዊ ያ ሁላ ፔሸንት እያለበት ሃው ክን ዳት ፊዚሽን ቢ ዲስ ኢሞሽናሊ ኢንጌጅድ ሆኖ ከአንድ ፔሸንት ጋር ይሄንን ናሬቲቭ ሜዲሲን የተባለውን ቶፒክ ፕራክቲስ ማድረግ የሚችለው እንዴት ነው የሚለውን ፕራክቲካል ስናደርገው እንዴት ነው ማድረግ የምንችለው?
አንዳንድ ጥሩ ጥያቄ ነው። ታይም አንዱ አስቸጋሪው ነገር ታይም ነው። የኬር ፕሮቫይደርስ እና የፔሸንቶቹ ሬሽዮ በጣም መስተካከል አለበት። አንቺ እንዳልሽው ግን ለምሳሌ አሁን አንዳንድ ቦታዎች አሉ። ለምሳሌ ዋርድ ውስጥ ለምሳሌ ያው ሊሚትድ ነምበር ኦፍ ፔሸንትስ ነው ያለን። ግን ኢቭን ራውንድ ስናረግ እንኳን we don't even converse with them አይደል? እንግሊዝኛ ነው የምናወራው። ብዙ ሆነን ተሰብስበን ከዛ ምንም አንነግራቸውም እንሄዳለን እና ሙሉ በሙሉ ፕራክቲስ ማድረግ አይቻልም ብዬ አላስብም። ኦፒዲ ለምሳሌ 60 ሰው ማለት የሚገባሽ ቀን ላይ ከሆነ ለእያንዳንዱ በሽተኛ መሰጪው ጊዜ በጣም አጭር ነው። በዛ ጊዜ ምንም አይፈረድም። ነገር ግን there are places አሁን just ኤግዛምን ብታደርጋቸው there are places ለምሳሌ የኮንሰልታንት ኦፒዲ በብዙ በሽተኛ ያያዝ ጥቂት በሽተኛ ነው ያለው። ዋርድ ውስጥ ያሉት እንቅስቃሴዎች ሞር ኦር ለስ ታይም ይሰጣሉ ከበሽተኛ ኮኔክትድ ለመሆን። እንደውም ራዘር ነርሶች ናቸው በጣም ኮኔክትድ የሚሆኑት ዋርድ ውስጥ። ስለዚህ በዛ መጀመር ይቻላል። ግን አንድ ቀን የእንትናችን ቁጥራችን ባላንስ የሚመጣበት ጊዜ አለ። ትልቁ ነገር ግን ምንድነው አሁን is just to understand what is going on። አሁን እኛ ከፔሸንቶቹን በታይም እጥረት በበርናውትን በለው ምንም በለው በጣም ዲስታንት ነን። እነሱን ኢንጌጅ አናደርግም። how many of patients በዲያግኖሲሳቸውን ያውቃሉ before going to the OR? how many of patients do know the complication of the drugs or the complication of the surgeries? ሌላውን ተተሽ ካልቸራል ምናምን ተተሽ እንኳንና መርጦ ሴሌክቲቭሊ ግን የናፕላይ ማድረግ ይቻላል። የመጀመሪያው ነገር ይሄ ነገር እንዳለ ማወቅ ነው። ባዮሜዲካል ብቻ የሆነው ፕሮሰስ የትም እንደማያደርስ ማወቅ ነው። ከዛ በኋላ ግን አፕላይ የሚደረገው ቦታ ላይ አፕላይ ያደርጉ ይቻላል ያስባሉ። ታይም ግን እንዳልሽው አንዳንድ ቦታ ላይ ኮንስትሬንት ሊኖር ይችላል።
Okay, thank you, doctor.
ብሩክ አንድ ጥያቄ ጠይቆኛል። አንድ ፎረም አለ በየወሩ የሚደረግ ፎረም ነው። አሁን ለምሳሌ ከሁለት ሳምንት በኋላ we'll have ኢሞሽናል ኢንተለጀንስ ዲስከሽን ይኖረናል። ስለዚህ ሜላት አገናኝሽና ከዶክተር ሱራፌል who is coordinating the forum ጆይን ማድረግ ትችላላችሁ። it's going to be on Friday ከአንድ 10 ቀን ምናምን 15 ቀን ከ13 ቀን በኋላ ይካሄዳል 12 ቀን እና ማንም ሰው ጆይን ማድረግ ይችላል። we'll make it virtual እናደርገዋለን ለእናንተ። we had also discussion on conflict management in healthcare previously ነበር። እሱንም ለእናንተ ማቅረብ ይቻላል ከፈለጋችሁ።
እሺ ዶክተር we would love to.
Thank you so much. I think ታይማችን ደረሳለም ሜላት።
Yes doctor.
Thank you so much. በጣም ግሬትፉል ነኝ ይሄን ኦፖርቹኒቲ ስለሰጣችሁኝ። ፈርዘር ዲስከሽን ምናምን የሚፈልግም ከሆነ I am very much happy. This is my area of passion. እና ሜዲሲንን from a very different perspective ለማየት አስችሎኛል። ስለዚህ I hope እናንተም እንደኔ ቻንስ አግኝታችሁ የሜዲሲንን ፐርስፔክቲቭ ብታውቁ ጥሩ ነው። የሪማኒስን በሚመለከት there are some processes in the medical school early ነው፣ ግን አንዳንድ ፕሮሰሶች አሉ where I am also involved። ስለዚህ any ዲስከሽን የሚያስፈልግ ቶፒክም ካለ ለዛሬ እዚህ በቃናል። በጣም አመሰግናለሁ። thank you so much።
እሺ ዶክተር thank you, we appreciate it too.
Thank you so much.